Obviously, the initial problem that you came in with was your neck, wasn't it?
Yep.
Yeah. So what we're going to do now is I'm just going to put some stress on your neck in various angles, and we're just going to see where we are at this point in our treatment program. Okay? Fantastic. So, just going to put some weight on it. Tell me if there's any discomfort. I'm looking for restriction in movement. You're going to tell me if it hurts in any way at all.
Okay.
So I'm just going to put some stress down. Any pain there at all?
No.
Wonderful. Now I'm going to take that ear and I'm going to bring it to the shoulder. So if you do that first for me. You okay with that?
Yeah.
Good. Any tension or pain there?
No.
No, good. So I'm just going to push down your neck here and you're going to tell me if there's anything there at all.
No.
No? Wonderful.
A little bit of a stretch.
A little bit of a stretch in there. Okay, but nothing on this side?
No.
No, wonderful. We're going to do the other side. Now, I'm expecting a stretch on that side because obviously we are stretching those muscles. But what I'm really doing is I'm compressing the facets on this side of your vertebra here, and we're just looking to see if there's anything that's stuck, anything that's not moving, anything that might be sort of in any way uncomfortable or painful. So I'm pushing down that way. Anything?
No, stretch there.
Yeah, stretch there again, just like the other side.
Yep.
Yeah, perfect. And go all the way down now. Now chin to chest, and go all the way down. And again, I'm expecting a stretch here. Is there anything else? Apart from just a stretch there, anything else at all?
Don't think so.
No, wonderful. Now I want you to look up at the ceiling. So look up all the way. Okay. And I'm just going to, again, I'm going to push in that direction in your neck. Okay. So along the spine, we're just going to increase the lordosis there. Anything at all?
A tiny bit, move at the back.
Right. Whereabouts? Keep your fingers on it and don't move it, okay? Keep your fingers there. You got it?
Yep.
Okay, good. So keep your fingers there and just bring your head down. Right, so we're about C. If you come down this way. So we're around C4, yeah, C4, 5. C4, 5, 6 are the most common damaged vertebra in the human spine, just purely because of that beautiful lordosis, that shape that we have there. They are because of the anatomic shape of them, they, like L4, 5 in the lumbar spine, are the ones that take the most amount of stress. So we're just going to do some P to A palpation. So from the back to the front, I'm just feeling, and I'm feeling a little bit of restriction there. Can you feel, if you feel that one, Nick, can you see how that one's moving quite well, isn't it?
Yep.
If I go to the one above, can you see how that one gets a little bit stuck there, doesn't it? If we go to the one above, it's moving well, but this one here doesn't want to move that way, does it?
Yeah.
And you can feel that. So what we want to do is, that is the restriction in the joint. And unfortunately, Nick's got a long-standing neck problem here. So the more we can move the joint, the more we can get some normal movement back into the joint, the better for the neck. Because the more immobile it is, the more the muscles are tight around the joint, the more it's going to potentially become osteoarthritic. So we don't want that, because that's all osteoarthritis is long-standing stress on a joint. Okay, so we've got some more movement in there. So all I did was I used a chiropractic tool called an activator to put a very shallow thrust through that joint and just mobilize it. Right, so Nick, so look up again for me. Okay, how does that feel now?
Yeah, I think mine's better.
Yeah, marginally better. Okay, good. So there's been a slight improvement. I mean, obviously, you're going to be feeling a little bit of discomfort from the adjustment as well.
Yeah.
But if we just move it now and just get a bit of movement back into the joint, and we try again and do it again now. And that should feel even easier. Does that feel easier?
Yeah.
Excellent. Good.
Yeah.
So now we've done all the movements except for rotations. Now we're going to just rotate, because we did flexion, we did extension, we did lateral flexion. Now we're just going to do rotation. Wow. That's pretty good, isn't it?
Not bad.
Yeah. It's pretty level to your chin. Wow. That's a massive difference from the start, isn't it?
Yeah.
Yeah. Marvelous. So that's a neck assessment and a neck adjustment. Now Nick has got a history of sort of neck issues, so obviously we've gained a lot from the adjustments there, and that's literally what we're doing here. Sort of as a chiropractor, it is absolutely what my goal is. My goal is to give you as a patient the best mobilization movement that we potentially can in any sort of vertebra. Your cervical vertebra, your thoracics, your lumbar spine, and any peripheral joints, shoulder, elbow, knees, hips as well. And that's my goal. So here at Bedford Chiropratice Clinic, that's what we do for you. Nick, thank you so much for agreeing to do that. Appreciate that.
Thank you.
Thank you. Bedford Chiropratice Clinic. Do follow us on social media. Look at some YouTube videos. We've got lots of educational videos out there. We are here to help you get the best out of your health. And I look forward to helping you. Give us a call.